Good morning, judges, fellow contestants, organizers, and guests. Enhanced recovery after surgery is a perioperative approach developed to hasten the patient's recovery and shorten the hospital stay. In the preoperative period, prolonged fasting is avoided by giving a carbohydrate load. The premise is to prepare the body to hurdle the surgical stress by being in a fed state rather than in a fasted state. Carbohydrate loading then is given 2 hours prior to surgery in a form of 12.5% glucose in maltodextrin form. This is to modulate the stress response post-operatively by preventing insulin resistance, improve protein retention, and lean body mass preservation, thus promoting patient well-being, immunity, and nutrition following surgery. Maltodextrin, however, can cause allergic reactions, gas, flatulence, and bloating. In the locality where I came from, the availability of the standard glucose load is limited. That's why we explored the possibility of using alternative carbohydrate drinks in the form of fresh coconut water and sugarcane juice. We found out that these two solutions also contain some useful components such as protein, fat, potassium, and some minerals. Sugarcane juice, however, has a higher sugar content of 19.57% as compared to the coconut water. After determining the components of the coconut water and sugarcane juice, 45 healthy volunteers were enrolled in the study. All of them were exposed to 1 glass or 240 ml of coconut water, sugarcane juice, and plain water as control for 3 separate days, 1 day apart after fasting for 8 hours. On day 1, preprandial blood glucose levels were obtained, followed by measuring the baseline gastric volume in the antropyloric region of the stomach through an ultrasound by a radiologist. After this, participants were asked to consume 1 glass of coconut water. The gastric volume was again measured at 30 minutes, 60 minutes, and 90 minutes after consumption of coconut water. And at 120 minutes or 2 hours after, gastric volume was again measured along with the postprandial blood sugar levels. The process was repeated on day 2 with sugarcane juice and on day 3 with plain water. The return to baseline volume determined that the solutions were already emptied from the stomach. And the results were, for the coconut water group, the average baseline gastric volume is 16.5 ml. Majority of the participants, or 29 out of 45, had their gastric volume returned to baseline at 60 minutes, followed by 12 out of 45 participants at 90 minutes and only 3 at 120 minutes. For the sugarcane juice group, the average gastric volume is 16.8 ml. Majority of the participants, or 20 out of 45, had their gastric volume returned to baseline at 90 minutes, 13 out of 45 at 120 minutes, and followed closely by 12 participants at 60 minutes. For the control group, the majority of the participants, or 25 out of 45, had a return to baseline gastric volume at 30 minutes, then followed by 19 participants at 60 minutes, and only 1 at 90 minutes and none at 120 minutes. The average pre- and postprandial blood sugar levels of all participants who took these 3 drinks have no clinical significance since they were almost at the same levels. Coconut water and sugarcane juice did not increase the blood sugar levels of these healthy individuals 2 hours after their consumption, although there was an increase of 1 milligram per dl in the average postprandial blood glucose in the sugarcane juice group. This is still within the normal limits, and this can be attributed to a higher sugar content of sugarcane juice at 19.57% as compared to the standard solution of 12.5%. the results at hand, we can now safely say that the natural drinks, the coconut water and sugarcane juice, can be used as alternative carbohydrate loading solutions to be given to relatively healthy ASA 1 patients without risking them for bronchoaspiration. Both alternative drinks were also emptied within the 120-minute mark, and both did not significantly increase the blood sugar levels after consumption. Considerations for future application or research are as follows. First, perhaps the combination of the coconut water and sugarcane juice can approximate the 12.5% glucose solution, not to mention they also contain useful products such as protein, fat, some electrolytes, and minerals. Second, this combination can be pilot tested on healthy ASA 1 patients for elective surgery in order to determine acceptability to both the patients and surgeons, and as well as ERAS endpoints of length of stay, cost, and post-operative complications. And lastly, to determine the suitability of use in ERAS protocol for a greater number of patients, a similar study may be done in diabetic patients with either the use of coconut water or sugarcane juice or a combination of both. Thank you.
Okay, that's a very good research work about your coconut water, sugar cane, and water. Of course, you know, you should have made a comparison only between sugar cane juice and coconut water, because we all know that water, plain water, does not have any sugar level. In your presentation, please do not put the computer output of the resort, because non-statistician will not understand your results. So, you kindly provide tables that are easily understood. In the analysis, you may also compare the differences in the blood glucose level between the three groups to know which of them is the most effective.
The blood glucose level, doctor, was measured for these three groups.
Good morning.
Good morning,
And congratulations on being one of the finalists. Okay. Just a comment. What do you mean by snowballing when you recruited your participants?
So I recruited those participants whom I know or whom my friends in the hospital know, and then snowballing, they recruited their friends also.
Actually, as far as I know, it's a type of non-probability sampling, but you use this in populations that are hard to locate. Halimbawa, yung mga HIV patients, yung mga ganon. So I think it would have been better if you have used the term purposive sampling. Okay. And then the format of your paper, patalon-talon, it should be introductions, objectives, methodology. Parang nauna yung methodology mo before the intro. Okay. And then last, you use crossed over study design. Okay, so what are the issues involved when you do a crossover design?
In this study, doctor, there was none actually.
Okay, the issues on using crossover design would be yung order of effects when the ordering of the treatment that you will be giving. Then the other one would be the carryover. So because it may affect the results. For example, yung una, binigay mo itong drink na to, water. Then the other, parang baka magkaiba yung result. So, ang ginagawa is long washout period. So, okay naman kasi 24 hours yung sa'yo. And then, for the analysis, why did you use t-test?
T-test, it is to compare the baseline from the 30 minutes, 60, 90, and 100 minutes, doctor.
yun nga, as far as I know, t-test is when you use two populations. You are using a crossover study. So actually, same patient, different day. So it's a repetitive measure. So you go back to your statistician. I think the proper statistical analysis would be an ANOVA, not a t-test. Okay?
Thank you, Dr. Noted.
Okay. So tama yan, dapat